Hi, my name's Tony Wilkinson. I'm a consultant podiatric surgeon here at the Yorkshire Foot Hospital, and I'd like to talk to you today about a condition known as Hallux Valgus, or more commonly known as bunions. Now, this is a very common condition that affects females more than males, usually in a ratio of 3:1. And essentially it's a condition, not only is it a bump of the big toe, but the bone in the first metatarsal here splays out away from the foot. So where you can see on this skeleton there's a nice parallel bone of the first and the second metatarsals. With Hallux valgus, this bone, the first metatarsal, splays away from the foot, and as a consequence the big toe tends to creep inwards towards the second toe. Now, over time that can either pass underneath or over the top of the second toe and cause deformity in the ball of the foot. Often people will start to develop hammer toes where the second toe bends, or develop pain in the ball of the foot as the pressure is transferred from the outside of the foot to the inside of the foot. Now, there are a number of ways in which you can treat these. You may have seen on the internet or in the papers splints known as night splints for correcting Hallux valgus. Now, there's no evidence at all to suggest that these work in the long term, and whilst they may give patients temporary pain relief by cranking the big toe straight when they're used, there's no evidence to suggest that it will continue to correct the deformity, and over time it's likely just to deteriorate. In order to get pain relief, sometimes you can use special pads over the side of the joint, or you can use orthotic insoles underneath the foot, which will support the foot, but again it will not change the deformity. So the only way to really deal with the problem is by an operation, and the general school of thought is that we need to cut the bone, the first metatarsal, and move it back into the foot, so we correct the deformity at that level. We tend to place little screws inside the metatarsal, which look rather like these small screws just here, and these sit very flush with the bone and stay there forever. And then once we've done that, we turn our attention to the big toe and often take a little wedge of bone out and pull that straight, and again fix it with a tiny screw. Now, the recovery from this procedure is quite quick. 2 weeks of resting following the surgery, so you're asked to keep the foot elevated. You can weight bear on it to go to the loo, to make a cup of tea, to make a snack, but the more you keep it elevated in that first 2 weeks, the less swelling you'll get, the less chance of infection. After 2 weeks, we ask you to get back into a closed-in shoe, something like a trainer or something that will lace up, and that will put pressure around the foot and help to reduce the swelling. And you can gradually increase your weight bearing on the foot between 2 and 6 weeks. Normally by 6 weeks, patients are starting to go back to work and get back to normal activities such as walking, running, gym work. Don't suffer in silence. Come and see us here at the Yorkshire Foot Hospital.